Hope Channel, changing lives.
Hi, good evening, lovely people, and welcome to another edition of the Consulting Room, coming live to your homes from the studios of Hope Channel, Ghana. We are glad you get to join us every Monday from 8 to 9 p.m. As usual, we're going to be talking about something very interesting today. I'm Dr. Naika Inin, and I'll be your hostess. A few years back, there used to be a lot of news and information on radios, TVs, newspapers about HIV. Lately, we don't hear much about it, but I want to assure you that HIV is still very real and is here with us. And tonight, we're going to go into a discussion and talk to you about everything you need to know about HIV, the do's and the don'ts, and I'm sure you can't wait. With me in the studios, I have two very learned people who are going to help us with our discussion. I have with me Dr. Ellen Epieje and Dr. Salasi Akudadi. You are both very welcome to our studios, and thank you for honoring our invitation.
Thank you for having us.
Sure. I'm sure you can't wait to get into the discussions, but before we do that, I'd like to recognize our sponsors. Cocoa Milk. Cocoa Milk is a dairy-free, unsweetened, full plant-based coconut milk, and it's your go-to for all your milk needs. It has all the right vitamins and minerals in the right proportions for a great health. Also, I'd like to remind us of PellaFest. The PellaFest A Cappella Festival is happening on Saturday, December 31st, 2022 at the National Theatre. Starts at 5 p.m. Tickets are running out very fast, and I'd like to remind you to grab your tickets now. A regular ticket is going for 70 Ghana cedis. A VIP ticket is going for 150 Ghana cedis, and for a family of 5, it's going for 300 cedis. Let's remember to grab our tickets. And we'll go for a quick commercial break. When we get back, we'll get right into the conversation. Stay tuned.
Dairy-free coconut milk. Cocoa dairy-free coconut milk is a fully plant-based milk, non-curdling in tea or coffee, and it's a lovely treat with any breakfast beverage or meal. It contains calcium and vitamin D2 for strong teeth and bones, and vitamin B12 to help boost your blood for vitality. Cocoa is 100% vegetarian and is approved by the Vegetarian Society of UK. It's also lactose and dairy-free, which is good even for people with lactose intolerance. Cocoa, get one today. Cocoa dairy-free coconut milk. Nature's health at your doorstep. For bulk purchases, contact 027-444-0180. This advertisement has been vetted and approved by the FDA. Cocoa dairy-free coconut milk.
For one night only, the city will converge at the National Theatre as United in Praise presents the A Cappella Festival.
Why don't you get up and give the Lord a shout of praise?
Yes, race for a swell musical experience on Saturday, December 31st, as Ghana's hottest a cappella groups usher us into 2023 in style. On stage, Black Capella, The Manifest, Vocal Power, Note 6, K3M, New Era, Soul Street, with a special appearance from Pestak Praise, Gifty Dia, Mark Enim, and Perez Music. Tickets are selling now for a cool 70 Ghana cedis single and 150 Ghana cedis VIP. Or you can go for 300 Ghana cedis for the family of 5. Dial star 928 star 529 hash to purchase your tickets. Get ready for the A Cappella Festival live at the National Theatre. Don't forget, the date is Saturday, 31st December. The gate opens at 5 p.m. sharp.
The A Cappella Festival is proudly endorsed by Beyond the Return and supported by Charterhouse, Events Dome, Midima Foheba Clinic, Meridian Ghana Conference.
This event is powered by United in Praise.
commercial break. I'd like to remind you that you can send in your questions and comments to our various social media platforms. For the past couple of weeks, I've seen a few tweets and posts on social media about the high incidence of HIV in the population, and it's quite scary. Some statistics from the Ghana AIDS Commission tells us that about 21,000 people are getting newly infected each year for the past 5 years. And that's quite a large number, and it's quite alarming. World AIDS Day was celebrated about 2 weeks ago, and I think it's in the right order that we need a full day to celebrate HIV/AIDS. It's such a serious illness that you need a full day dedicated to create awareness and educate people, because it seems like we've forgotten about HIV. COVID came and it seems everyone forgot about HIV. But we'll get into the conversation, and I'm sure by the time we're done, we'll have a lot of information about HIV, how to prevent it, how to deal with people who have it, and all other things as well. So I'll get right into the questions. So we'll start with Dr. Appiagyei. What's all the fuss about? What is HIV?
Okay, so basically, HIV stands for Human Immunodeficiency Virus. It's a type of virus that affects the human immune system and then damages it and then renders it at risk of being affected by a lot of wide range of diseases. Yeah, so that's basically what HIV is.
You said a lot of medical things. Can you explain to us what the immune system is and what it does?
So basically, your immune system is part of your body that helps you fight diseases. When you are infected by a bacteria or like any organism, it's your immune system that fights that disease or that infection. So then this HIV virus attacks that immune system, especially a part of it that has a part that is called the T cells. So HIV affects those and then renders you immunodeficient, meaning your ability to fight infection is reduced. Then you are prone to all forms of infections.
Okay, so the immune system basically like the soldiers of the body.
Exactly.
Right? Yeah. Okay. So usually we would hear HIV/AIDS, right? HIV and AIDS, are they the same thing? Dr. Daddy, can you talk to us about that?
So HIV and AIDS are not the same thing, but they are part of the same disease process.
Okay.
So anybody who has HIV can go on and progress to have AIDS, which is the acquired immunodeficiency syndrome.
Okay.
So usually if someone acquires the HIV virus, in the beginning, the earlier stages of the disease, it's not considered as AIDS yet. But if you leave it untreated and it progresses and starts to affect other organs in the body, starts getting prone to other infections and things, then we say that you've acquired the immunodeficiency syndrome, the immunodeficiency she mentioned.
Okay.
So when the disease progresses to the point where your immune system can't fight diseases at all, then we say that now you have AIDS and not just HIV.
Okay, so it's not necessarily that once you have HIV, you're going to progress to AIDS, right?
No.
So not everyone will progress.
Yes, it's not an automatic thing.
Okay. But can just anyone be infected with HIV, Dr. Appiagyei?
Yes, anyone at all can be infected with HIV. But then there are different factors that contribute to the chances of, or the chances, in the sense that in terms of sex, female and male, or gender-wise, female are more prone than male because it's believed that the semen has higher levels of the virus. And then when through sex, a woman is exposed, the higher surface area of the woman is exposed to the virus as compared to a man. The vaginal fluids, the concentration of virus in the vaginal fluid is relatively lesser than the male. Okay. So then women are twice as much as at risk as men. Oh. And then also other factors like the mode of sex, is believed that anal sex has higher chances than vaginal. So there are anyone can be infected with HIV, but then there are other factors that contribute to your chance, or increases your risk. Yes.
Okay. So it's not limited to just adults. Can children get it?
Anyone.
Children
can get it through their mothers. So
Okay. So if you see someone just walks in here, is there a way to tell that they have HIV? Is there something you see?
Most of the time, no. Most HIV infected patients look just like any normal individual walking around. It's only those who have the very advanced disease that it's very obvious that, oh, okay, there's something wrong with you. So there's absolutely no way you can look at somebody and say, oh, okay, this person has HIV, this person doesn't. So a safe way to go about life is to assume everybody's positive until proven otherwise.
Very true. Okay. So if we can't tell that someone is positive just by seeing them, how can we tell that someone has the virus or the disease?
Okay, so the only way we can tell someone has the virus is to get tested.
Okay.
So yeah, that's the only way you can tell someone has the virus, because even though there are some advanced form of the disease that might give you some symptoms that maybe an experienced medical personnel would be able to tell, would be able to suspect that this person has HIV/AIDS, but it is only through confirmatory tests that we could say vividly that this person has HIV/AIDS.
Okay. So Dr. Daddy, can you tell us, where can we get tested? We've heard a lot about HIV. Where can we get tested? Okay,
so you can get tested in hospitals, you can get tested at any family planning centers, but there are some self-testing kits around that you can do the test for yourself. But it's advisable that before you get an HIV test done, you go to a facility that can counsel you on what the HIV disease is, what to do if it's positive, what to do if it's negative, and things like that. And then also, if you do the self-test yourself, like if you do the test yourself at home and you realize that it's positive, you have to go to the nearest healthcare facility that has an HIV-trained healthcare worker who can counsel you and put you on the right medications to prevent you from getting the advanced form of the disease.
Okay. So the self-administered test, is it a blood test?
Yes, it is. So it's similar to I don't know how many of us have seen the malaria test. So it's the rapid diagnostic test. Yes, so it's very similar to the malaria test. So you just give yourself a small prick like the diabetes patients do on a daily basis. You get a little bit of blood, you put it on it, you add a reagent to it, and then it will tell you what the result is.
Okay. So how do we get the virus? You said a little about it, but if we can go more into detail, so if you can just add some more information.
So as we've already mentioned, there are different routes where we could get the virus through. The most common, which we know, and actually we think that is the main cause of the stigma attached to the disease, is the sexual route. So through vaginal sex, anal sex, through a mother could transmit it through to her baby, through pregnancy, birth, or breastfeeding. And then also illicit drug users who use needles and all sorts of things could also get HIV through that, and also through blood transfusion. But then the thing about blood transfusion is it's uncommon. It's not common to find a lot of people getting HIV through blood transfusion, because the blood transfusion process is quite safe. Most of the blood is screened, so that the chances of somebody getting HIV through blood transfusion is slim, but then it's possible.
It's possible. Okay. So if you catch the virus, which parts of your body are you likely to be affected with the virus, Dr. Dani?
Okay, so as she initially mentioned, so the virus attacks your immune cells. So when you initially get the virus, the place the virus would replicate, so the place the virus will multiply and increase in number is in your immune cells. So it attacks the immune cells, and then it multiplies, and then it attacks another immune cell, it multiplies, attacks. So you mostly, the first place of the body you would find it is the body fluids. So your blood, your semen, vaginal discharges and all those things. Those are the initial places you find the virus at. But as the disease progresses, it tends to spread to other parts of the body. So it usually starts in the blood, but then because the blood goes around the whole body, eventually the whole body to get infected by the virus.
Okay. So it's a systemic thing.
Yes, it's a systemic thing.
Okay. So there are a lot of falsehoods about how people get infected with HIV. You hear a lot of stories. People come to the clinics and they have a lot of false stories about how they possibly could have gotten infected. Some people say they ate with someone who had it and then they got it. Is that possible? Dr.
No,
is that possible?
that's not possible.
Okay.
As we said, even though we said that HIV is in body fluids, there's some body fluids that has almost little to no percentage of virus in them, like saliva. Yes, so then it's not common that somebody gets HIV through kissing, or somebody gets HIV, unless let me state this well, unless it's there's some break in the skin during the kissing process, because we've stated that the body fluid that has the highest concentration is the blood. So then if there's a break in the skin, or let's say the mouth, and then there's some form of mucosal, I mean, when I say mucosa, I mean, let's say the skin there, the skin of the lips. If there's any form of contact from both sides, then that is when you could get HIV through something like kissing. You can't get HIV through drinking from a cup of an infected person. You can't get HIV through casual contact, let's say me holding your hands, or any form of casual contact. Yes, all those things are not means of getting HIV. As we stated, body fluids like blood, semen, breast milk, and yes, others, those have higher concentrations.
I've actually even heard someone say that you can get it from a mosquito bite.
No, please. No, please.
Okay. Are there any other myths you've heard about, Dr. Daddy, on how to get infected?
I think she's mentioned, people say you get infected by shaking hands. People say you get infected by taking care of someone who has the HIV virus. I mean, if you come into contact with the person's blood and you have any broken skin or any point of entry on your body, then you could get the virus. But just washing the person's plates, washing the person's clothes, those things are not ways in which the virus can readily be transferred from that person to you.
So why should I get tested? HIV is really scary. I don't want to be diagnosed and then I'll be living with the fear hanging over my head. Why should I get tested? Why is it important?
So it's necessary to get tested because early diagnosis saves life. As Selassie already said, the disease is a progressive disease. When you get infected with a virus, which is the HIV, at that stage you just have HIV. You've not yet gotten AIDS. And the disease progresses. As the disease progresses, it breaks down, as we already said, it attacks a part of your immune system called the T cells. So, which is also called the CD4 cells. So even in hospitals, the HIV is, the progression of the disease is monitored by your T cells, the CD4 cells. So then the understanding is that when the virus attacks those cells, it breaks down the cells. So your amount of CD4 cells in your body correlates with how severe your disease is. So then if somebody has more CD4 cells, we're expecting that her HIV progression will be a bit lower than someone who has less CD4 cells, because it's assumed that if the person has less CD4 cells, meaning that the HIV is actively replicating and then breaking down his or her CD4 cells. So then if you get tested early, then you could be started on your antiretrovirals early. Then your HIV or your viral load, which is the amount of virus in your blood, could be kept at the lowest minimum. If it gets to that point, you can actually have a very normal, productive, like every individual. And then it's known that the World Health Organization states that at that point, most people are not infective, meaning you can't even transmit it to someone when your viral load is to the barest minimum. So then it's actually better you get tested early. You could be a positive wife with a negative man and you would live a happy life. Okay. So it's good we get tested early. So
HIV is not...
It's not a death sentence. Yes, exactly.
Think, right? So you could actually...
It used to be scary, but not anymore.
So you could actually have it and then you won't be infecting people with it?
Not at all. Once you go take your medications and then the progression of the disease has been monitored, you're fine.
Okay. So you've told us that, Dr. Daddy, but is there a cure for HIV?
Okay, so there's no cure for HIV. The medications we have in the system now help to control the disease. Okay. So it controls the progression of the disease. So it helps to, so HIV is grouped into stages. So it helps you from progressing from stage 1 to stage 2 to stage 3, which is the worst form of the disease, and stage 4. So we have medications that are available, which you take them on a daily basis, and then they help to keep your viral load down, and then they help your CD4 counts to be high enough so that your body can fight other infections and things. However, there's no cure. So once the virus is in your system, there's nothing we can do to take it out.
Okay, so Dr. Daddy, basically you're telling us that people with HIV will be taking medications for life?
Yes.
Okay. Yes. So is there a way that like, is the medication subsidized for them, or it's not too expensive?
So the medication is free.
Oh, okay.
Yes. So because of the numerous programs that are around trying to reduce the number of people living with HIV/AIDS and reduce get a lot of people to be tested and help a lot of people to know what their status is, HIV medications are completely free. So once you are tested positive, you go to a health center and they counsel you, and then you are started on the medications. And every time you run out, you just go back there and then they give you a new stock of the medications. So HIV medications are completely free. You don't pay anything for them.
Okay. So you just need to go and show that you're actually positive?
Yes.
Okay. But are the medications actually effective?
Yes.
Yes, they are.
Yes, they are.
Okay. So we encourage everyone out
because
there.
the medications are effective, that's why we have people living. At first, you hardly hear of people who have lived with HIV for 30, 40 years. But now you hear of such, because these medications are there, keeping their viral load low, and they are having the best of lives they could have, living like any normal human being.
Yeah. Okay. Dr. Piaget, there are some people out there who think antibiotics are like the go-to treatment for every illness. Is there a place for antibiotics in HIV management?
Not necessarily, no, because HIV is a virus. So then the drugs that target HIV are antivirals. Okay. Yes. Okay. Antibiotics are antibacterials, so they target bacteria. So then HIV, antibiotics do not necessarily have a place. Okay. So that's just a note to our viewers. Antibiotics do not treat just every disease. Antibiotics are for bacterial illnesses. HIV is a viral one. So if you are diagnosed with HIV, you need to get an antiviral to treat that. Okay. So, Dr. Daddy, they'll be taking the medications for life.
Yes.
Are there any side effects to the medications?
Okay, so usually when you start the medication, so the medication is formed from a combination of drugs. So it's not just one medication. Okay. It's 4 different medication or 3 different medication put together, and then in one tablet, and then you take that. This is to help prevent the virus from becoming resistant to the medication. Okay. So some of the side effects of the medications, they are usually earlier on when you start taking the medication. So you can have diarrhea, you can have headaches, you can have mood swings, you can have vomiting, nausea, you can have skin irritations, you have every part you can, but the most common side effects we see are usually in the GI tract. So that's the diarrhea, vomiting. But usually after you've taken the medication for some time, those symptoms should subside.
Okay.
If you take them and they are not subsiding, you have to see your doctor, and then we'll change the combination of medication that you are taking to see if that would help with the side effects.
Okay, so with this long list of side effects you've given us, Dr. Daddy, if someone is newly diagnosed and they realize, I can't deal with all these side effects, should they stop taking the medications? Would you advise them to stop taking their medications?
So anytime you take any medication, because it's not just the antiretrovirals that give side effects, every medication has side effects. So anytime you are put on any medication and you realize you are reacting to the medicine in a way that is not normal, the best thing you should do is go back to the person who prescribed the medicine for you and tell them that, well, when I took the medicine, this is what happened to me. And there are numerous medications there, so we can always try and find something else that can treat the disease you have, but give you less side effects. So the same thing can be done for HIV. There are numerous combinations of drugs based on different factors. So if you are not reacting well to one, we can move to the next one and see if you do better on that one.
Okay. Dr. Piaget, so how friendly is the hospital environment to people with HIV? Because I know usually there's like an HIV clinic that they walk into, so everyone knows that you walking into the HIV clinic, you have HIV, right? Like, like how hospital friendly is it, like environment for them, like coming to the hospital? Because clearly you don't have to be coming for refills and things, right? Yeah.
Well, for the hospital environment, I'd say it is friendly in the sense that patient's confidentiality is actually ensured. Somebody could be diagnosed with HIV and it's up to her to decide if her family would, him or her to decide if her family would know or not. And the doctor or the healthcare personnel would have to respect that.
Yeah.
For the different parts of the hospital, now we can't do anything about it because we need to, demarcate the areas so that we know this is for that, this is for that. But it doesn't necessarily mean anyone who's seen at the HIV clinic has HIV, because healthcare personnel take post-exposure prophylaxis, where when someone is exposed to HIV, they have to go to the ART clinic and then probably talk to them, and then they are started on PEPs. In that sense, if you see the person doesn't necessarily have HIV.
You're going very fast.
So,
what's ART?
Sorry, my bad. The antiretroviral therapy.
Okay, so that's the medication.
Yes, the medication. So,
okay.
What the point I'm trying to make is that we can't say that anyone seen at the HIV clinic has HIV.
Okay.
But then, if you have HIV and you get to the clinic, your confidentiality is assured.
Okay.
Your medications, sometimes their medications are actually served in a very, in a way that is quite okay, and nobody knows what you are taking. Yes, so I'd say that the hospital environment is the safest place for patients when it comes to HIV.
Okay.
And yes.
Okay. Dr. Daddy, so if someone is diagnosed with HIV, are there other illnesses they are more prone to?
Yes. So as we said, HIV affects your immune system, and your immune system are your body's soldiers. So if the soldiers are not available, any offensive attack from anybody can affect the body. So they are prone to a number of infections, such as pneumonias, that's chest infections, they can get skin infections, they can get, so we have what we call opportunistic infections.
Okay.
So these are infections that are just there waiting for your immune system to just like slack, then they'll be there to take over your body. So most HIV patients get infected by opportunistic infections.
Okay.
And then these opportunistic infections can affect the brain, the chest, the GI tract, your skin, and all that. So those are some of the things that come in addition to the HIV. But most of the time, this happens when your viral load is high. So if you are put on medication, we don't expect that you should get too many opportunistic infections. Another opportunistic infection or another co-infection that we have to pay attention to is tuberculosis. So most HIV patients tend to get tuberculosis when their immune system, because It's believed that almost everybody in Ghana has some latent form of tuberculosis in their system.
What's latent? What's latent?
So everybody in Ghana has the weakened form of tuberculosis, or the inactive form of the tuberculosis in your system. So once the immune system gets to a point where it cannot do the work it usually does, it cannot fight infections, then this tuberculosis resurfaces, it reappears. And then so tuberculosis is one of the most common co-infection that HIV patients get.
Okay, so Dr. Daddy, I'll ask you the last question, then we'll go for a quick commercial break and get right back. So are there routine tests done when they come to the clinic to find out if they have these infections?
Okay, so as we said, the medications come with side effects. So when you come to the clinic, aside from checking your general well-being, seeing how you're tolerating the medication, talking to you to see how you are coping with things and all that, another thing we need to do is to start checking the body for side effects of the medication. So you usually do a blood test, which is the basic blood test we all do. We want to check your liver's function, we want to check your kidneys function. And these are all tests to just make sure that the medication is not causing more harm than good. And then if there's anything that is happening on the medication, we can quickly see it and start putting measures in place to prevent it from getting to the point where it cannot be brought back.
Okay. Thank you so much. So, viewers, I'm sure we are enjoying the discussion, but we'll go for a quick commercial break, and when we get back, we'll get right into the discussions. Please stay tuned.
Dairy-free coconut milk. Cocoa Dairy-free coconut milk is a fully plant-based milk, non-curdling in tea or coffee, and it's a lovely treat with any breakfast beverage or meal. It contains calcium and vitamin D2 for strong teeth and bones, and vitamin B12 to help boost your blood for vitality. Cocoa is 100% vegetarian and is approved by the Vegetarian Society of UK. It's also lactose and dairy-free, which is good even for people with lactose intolerance. Cocoa, get one today. Cocoa Dairy-free coconut milk. Nature's health at your doorstep. For bulk purchases, contact 027-444-0180. This advertisement has been vetted and approved by the FDA. Cocoa Dairy-free coconut milk.
For one night only, the city will converge at the National Theatre as United in Praise presents the A Cappella Festival.
Why don't you get up and give the Lord a shout of praise?
Yes, brace for a swell musical experience on Saturday, December 31st, as Ghana's hottest a cappella groups usher us into 2023 in style. On stage, Black Capella, The Manifest, Vocal Part, Note 6, K3M, New Era, Soul Street, with a special appearance from Pestak Briggs, Gifty Dia, Mark Enim, and Perez Music. Tickets are selling now for a cool 70 Ghana Cedis single and 150 Ghana Cedis VIP. Or you can go for 300 Ghana Cedis for the family of 5. Dial *928*529# to purchase your tickets. Get ready for the A Cappella Festival live at the National Theatre. Don't forget, the date is Saturday, 31st December. The gate opens at 5 p.m. sharp.
The A Cappella Festival is proudly endorsed by Beyond the Return and supported by Charterhouse, Events Dome, Midima Fuheba Clinic, Meridian Ghana Conference.
This event is powered by United in Praise.
Welcome back to the consulting room. I'd like to remind you again to send in your comments and your questions to our social media platforms. We are very willing to answer them, and we'll get right into our discussion. So we've said a lot about HIV so far, but there's still a lot that we need to talk about. So previously, Dr. Peje, you mentioned that children could get it from their mothers. So how does that happen?
Well, so we've already stated that HIV is found in body fluids, including the blood and the breast milk. So then, through the placenta, when the mother is pregnant, as she's pregnant, the baby could get the HIV through that means. Then during birth, too, the baby could get HIV. And then also through breastfeeding, when she's breastfeeding the baby could get HIV. But then the good thing is, if these things are picked up before you deliver, there are precautions that are put in place to prevent the baby from getting HIV. Yeah, so that is why it's good for us to get tested during pregnancy, so that the necessary precautions could be taken.
Okay, Dr. Peje, so we've mentioned the side effects when we take the medications. So for pregnant women, like pregnancy is difficult already. Are they going to be going through the same side effects? Is it worse than for a regular person, or is it?
Well, the truth is, I wish it would be better for them, but there's no better way to say this, that they would go through the same side effects that any individual. And one thing we should know is that different people respond to different medications in different ways. Yes, so there are a range of side effects, but not everyone gets the same side effects. Okay. Yes, but then as a pregnant woman, it doesn't make you any exceptional from getting any of the side effects. You could get any of them.
Okay. Dr. Dadi, so we've mentioned that you could transmit it to your child from breast milk, but we also encourage people that breastfeeding is very important. So does it mean if you have HIV, you shouldn't breastfeed your child?
No, it doesn't.
Okay.
So any HIV positive mother, once you are started on your antiretroviral drugs and you're taking them, we expect that your viral load is at a level which will not be transmitted to the baby through breastfeeding.
Okay.
So once the mother is on medication and you can and she's taking the medications regularly, and you've checked and made sure that her viral load is well controlled, then she can go ahead to breastfeed. But another thing you have to remember with HIV positive mothers is that you can't do mixed feeding. So you can't breastfeed and formula feed. If you decide to formula feed, you formula feed. If you decide to breastfeed, you breastfeed. You can't start breastfeeding and then maybe like 2 months inside, you're like, oh, I'm tired. I have to keep waking up at night to pump breast milk and things. So now I don't want to breastfeed anymore. So you just switch to the formula feeding. It won't help the baby. It can make the baby prone to getting the virus that way. So that's one thing. So as long as a mother is taking her medications and her viral levels are at a low level, she can breastfeed safely and not pass on the infection to the child.
Okay, so in addition to that, one thing we should know is that these policies are a bit country specific, in the sense that it's in Ghana and some developing countries where HIV mothers are encouraged to breastfeed. But in some advanced countries, mothers are encouraged not to breastfeed because they have the resources to do formula feeding.
Okay.
Exactly. So in Ghana, we are allowed to breastfeed even on testing positive for HIV.
Okay. So for someone with HIV, can they go on to get married to someone who doesn't have HIV, Dr. PJ? Is that advisable?
Well, that's quite a difficult question, you know. Well, for this, I think it should be individualistic. It should be left to the individual. If you think you have your loved one and the person is HIV positive and you think that you're okay with it, whether the means of getting is convenient to you or not, and you're still okay with staying with a person, you can still be with a person and have a very fulfilled life where you may possibly not get infected. So HIV shouldn't be a death sentence for a couple, but that should be determined by the individuals, whether they want to continue or not. I can't say that. But if they decide to continue, we are there to help them.
Okay. If they decide to continue, what measures can they take to prevent the one without the HIV from getting it?
Okay, so as we've already discussed, the main goal of the HIV therapy is to keep your viral load to the minimum level. So then in this case, would encourage the infected partner to start the clinic, take their drugs regularly, be checking their viral load, so that they could keep it to the minimum and then not infect the other partner. With those practices, eat healthy, and then with support from the other partner, I think everything will be fine. Yes.
Okay. Dr. Ladi, how often do they check the viral load? How do you know that it's going up? How do you know it's coming down?
Okay, so when you go to the HIV clinic, or when you go to the clinic to get your HIV checkup done, your doctor will give you a schedule. Most of the times you come in the earlier parts of the disease, your checkups are more frequent. So probably you come every month for us to just make sure that you are doing okay and all that. Then after some time, it might be increased to about every 3 months. So usually they come every 3 months. And when they come for their 3-month checkup, you refill their medications, you check their viral load, and you check their CD4 counts. And then you also check to make sure they don't have any other opportunistic infections or any other things going on with them. So that's what you usually do at the HIV clinic.
Okay. Yes. But at the clinic, are they like, do they get psychological management as well? Are there psychologists around to counsel them, since it's something they would have for the rest of their lives?
Yes, so HIV is almost a multidisciplinary condition. So a lot of people come together to take care of an HIV positive patient. So a psychologist is a very important part in the HIV journey, because it's difficult for you to hear that you have a disease for which you have to take medication for the rest of your life. You have to change a lot of ways in which you used to do things. You have to be extra careful about how you go about your business. And then also in our setting, there's a lot of stigma associated with HIV. So once you hear that you have HIV, you're like, hey, all my family members are about to leave me, everybody's going to abandon me. So a psychologist is very important in the care of every HIV patient, and not just HIV, any disease condition, because it's very difficult to hear that, oh, you are sick. Everybody wants to be healthy and fit and going about their business, yes. So a psychologist is really, really important.
Okay, so since you brought it up already, is it the end of the world if you're told that you have HIV?
It is not. It is not the end of the world. Yes, because as we've been saying since the beginning of the program, with where medicine has gotten to now, where HIV was and where HIV is now, it's not the same thing. Previously, people die shortly after they are diagnosed and all that. But with the advances in the medication and with more research is being done, so it's not like we've just sat down and relaxed. So okay, now we have a cure for HIV. We have a way to control HIV. No, we are still trying to find newer and better ways of helping them to live healthy and normal lives. So HIV is not a death sentence. As long as you know your status and then you are doing what it is. So if you are negative, you are ensuring that you remain negative. If you are positive, you are taking your medication and making sure that your viral load is at a controlled level, then you can go ahead to do any and everything and live a normal life.
Okay. Dr. Piaget, so how long, if I think I've been exposed to the HIV virus, how long after exposure should I get tested to make sure I have accurate results? It's not going to give me any false negative or false positive.
Just false negative and false positive. Okay, so for HIV, the best thing is to test 3 months after. But you could test immediately and repeat 3 months after. This is because the virus has a period where it stays in the body. So first, the test kit tests the antibodies. And those antibodies do not appear in your blood until it takes about 2 weeks to 2 months, and sometimes even more, 3 months. So then we're expecting that by 3 months, the antibodies should appear in your blood so that when you test positive. But then it has...
Please hold on, please. What are antibodies?
I'm sorry. Okay, so antibodies are, should I say, things that your body produces so that they fight infections in response to a particular infection. So when I get HIV, my body will produce antibodies against the HIV. So we're expecting those antibodies to appear in your blood, because it is the blood we are using for the test, in your blood by 3 months. So we would say that if you get exposed to, you think you're exposed to the virus, then you could wait 3 months, then you do the test,
Okay.
then we're expecting it to be positive.
Okay. So that would be like the most accurate thing to do.
Yes,
after
yes.
3
But
months.
then if so, there are times where there's the initial stage of the disease where the individual could have flu-like symptoms, where maybe 2 weeks after you get exposed, you could have some fever, cough, like rash, and all that. So during that time, some people may test, then
Okay.
repeat after 3 months. But then one thing we should note is that it doesn't, we are not saying that before that 3 months, you can't infect someone. We are saying that 3 months, the soldiers justifies the HIV have not appeared in the blood yet. That is why you don't test positive.
Okay.
But then the virus is in your system.
Okay.
So then you can transmit it to someone. And that is actually the time, is one of the times where your viral load is at the highest level,
Okay.
where you could actually infect people easily. So during that time, the early stages and the last stage of the disease, those 2 times are the times that you could easily transmit the virus to someone.
Oh, okay, okay. Dr. Daddy, so we spoke about stigma. There's a lot of stigma that people with HIV face. How do we deal with that?
So, first of all, we have to understand what the disease is. So, if we are going around with myths that, oh, if I touch this person, I'll get it, and things like that, it doesn't help with the stigma. So, to get rid of stigma, we have to know what the disease is. We have to create awareness among a lot of people, let them understand what HIV is, what AIDS is, everything they need to know about the disease. So basically how it can be transmitted, the treatments, and things like that. So that's one way of getting away from this, like getting rid of the stigma in our society. And then also another thing we have to do is also, I think sometimes we as healthcare workers also contribute to the stigma. We tend to, in our bid to sort of like create awareness about a disease or something, we tend to create fear and panic. Like we tend to scare people. So you go and say a whole bunch of things, and then now everybody doesn't want to go and associate with that patient who's just tested positive. So I think we also have a part to play. We also have to give out the right information, make sure that we are telling people exactly what it is that the disease is, how it can be transmitted. We have to explain to people that once they are on medication, they are not a problem to society. And then there are also ways in which we can also protect ourselves when we are around them. So don't share sharp objects with them, have safe sexual practices and all those things. Like there are various ways we can also prevent ourselves from getting the disease. So someone who is walking around with HIV is not just spreading, the virus is not just emanating from the person as they walk around. No.
When she said that, can you get it from like coughing? Like when someone coughs, can we get it from that?
No. It's very unlikely.
Okay. So you've mentioned a few of those already, but Dr. Pedro, do you want to add something to it? How do we prevent ourselves from getting it? If we come into contact with someone with HIV, how do you protect yourself so that you don't get it? Apart from the safe sexual practices and the sharp objects and all that, is there anything else that you should do? Okay,
So we are a Christian channel. So for the Christian channel, would say for unmarried people, abstinence would be our best option. But then for other people, as she's already said, safe sex, well, I would repeat again, it's a Christian channel, so things like anal sex, we are hoping that it's not common among the Christian populace, but let's be objective as possible. Let's say it's not encouraged because it's believed that there's a 10 times infectivity by the anal route than the vaginal route. And also we're encouraging, thank God, the Hospitals screen the blood and blood products very well, so it's uncommon to transmit through that route. And we are encouraging people to get tested when they are pregnant so that they could have good care from their healthcare provider. And also would encourage HIV mothers to have planned pregnancies, in that you should take your time and decide to get pregnant. When you take your time and plan your pregnancy, you get to get preconception care, meaning that you see your healthcare provider, especially your doctor, you plan your pregnancy, your viral loads are brought to the minimum level, you take your time, get pregnant. Throughout the pregnancy, you are seen by a professional, your doctor if possible, till you deliver. Through delivery, the right precautions are taken, and then we bring babies who are not infected with HIV. And then also, yes, I think basically I'm not encouraging use of sharp objects and all that. Yeah.
Okay. Dr. Daddy, so you're both medical doctors. Is there any precautionary measures you take in the hospitals or clinics to make sure that people who come in with HIV, well, as you said, everyone is positive until proven otherwise, right? But how do you protect yourself to make sure that you don't go home with HIV? Okay,
so in the hospital setting, some of the precautions we use protective objects. So you use your gloves, you'd wear a gown, you'd wear mask, goggles, and all that if you are going to come into contact with an exposed person's blood. Then also another way we help protect ourselves is by washing our hands frequently. So you wash your hands before and after you do any procedure, and then you properly dispose of sharp objects. So you don't use a syringe or a needle and just leave it lying around. You dispose it in the sharp objects. Make sure you've capped the needle before you put it in the sharps box. And then we dispose of that. Then for the linen and clothing of people who have the virus, you make sure that you handle them properly. So before you touch them, you wear your gloves, you put them in the proper container, and then you send them to where they are supposed to be laundered and all that. Then another thing too is that sometimes because of the way our work is, you might mistakenly get pricked by a sharp object or something. So immediately you get pricked, you get tested to make sure that you don't have the virus, and then you are started on what you call post-exposure prophylaxis. So you are given medication post the exposure to the virus, and then you have to do that as quickly as possible because you have 72 hours within which the post-exposure prophylaxis is effective. So yes, so once you suspect that you are exposed to the virus, you quickly go and see the infectious disease specialist, and then they would counsel you, and then you start your medication. And then whilst you're on the medication, after 6 weeks, you go back and test again to make sure that you don't have the virus. And then if after 6 weeks you do not have the virus, you go back in 3 months. And then if in 3 months you do not have it, then we are sure that you do not have the infection. So those are some of the ways as health workers to protect ourselves.
Are you taking the same medications as those who are infected with the HIV? Is it the same one they're taking?
No. I
So,
don't think so.
So health workers are also at risk of getting it. So we all need to be careful. So there's a question that has come. We've answered it previously, but maybe Dr. Peje will just go over it for us. So the person is asking, are HIV and AIDS the same thing?
Okay, so we've stated that they are not the same. We said HIV is human immunodeficiency virus, and then AIDS is, so let me start this way. HIV is the virus, and then AIDS is a combination of the diseases you get when you're infected with HIV. So then, we've already stated that you get the virus attacks your immune system, you become immunodeficient, meaning that your immune system is not able to fight diseases anymore. Then now all forms of diseases attack you. So the time when all forms of diseases are attacking you, that is when we say you have AIDS. So acquired immunodeficiency syndrome, then we say that you have AIDS.
Okay. So for that viewer, I'm sure your question has been answered. I'm sure we've learned a lot from this discussion. I don't know if my panelists have any final words to our viewers.
Okay, so for final words, we would say that HIV is not as scary as it used to be. Formerly, HIV was a death sentence. Like if somebody is infected with HIV, you'd know that in a few years they'll die. But thanks to God, there's advanced medicine. God has given us the knowledge to study, to bring up drugs. Even though HIV has no vaccine and has no cure, but then there are drugs that would help prolong your life and give you a healthy life. So we're encouraging people who have tested positive and people who are yet to test, not to be afraid that they could go test. If you test positive, there are drugs to improve the quality of your life. If you test negative, we are encouraging you to keep preventing yourself from getting it. And then we're also encouraging mothers to test to help their babies not get HIV.
Okay. Sorry, Dr. Daddy, before you come in, there are a couple more questions that have come in. So someone wants to know, please, is it everyone who can be infected with the HIV virus? We've answered that already too.
Yes, everyone can be infected with the HIV virus once you come into contact with it.
Okay. And then someone also wants to know, what role does the hospital play after the person has tested positive for HIV? How is the person's confidentiality protected in the facility? And then does the facility have the right to disclose, I guess, like if the person is positive or not? Yeah.
Okay. So in the healthcare setting, your confidentiality is assured. So with the disclosure, before we can disclose anybody's HIV status to anybody else, you have to give us the authorization. So if you are married and, for example, a wife comes to get tested, a healthcare worker cannot tell her husband what the results of the test is. The wife has to come and say, oh, I allow you to tell my husband what the result was. Even though
it's likely it's going to infect her?
Yes, it is. So it doesn't matter what you think as a healthcare worker. You have to ensure the confidentiality of the patient.
Okay.
So I can't tell, even if I know very well that it's positive and you are engaging in any practice that I think is putting others at risk. All I can do is encourage you, the person who has been tested, to disclose your status to other people. But I can't go around announcing to the whole world that, oh, this person has tested positive. No, it's not done. So anybody who gets tested should be assured that their status will be kept confidential until they give us the authorization to tell their family members and loved ones and friends about it.
Okay. And that's one more question. We're wrapping up. The person says, I know a friend, when she was pregnant, she was diagnosed of HIV, and after birth, I asked her about it, and she told me that she was negative. How possible is it? So she was positive during pregnancy, and then after birth, she was negative. Is that possible? Dr. Fiaje, do you want to help us?
Well, I don't know at what point of the pregnancy she tested, but well, there's some room for false positives with tests. So maybe it could be that she tested negative. That was a false positive test kit. Exactly. So yes. So usually they are retested. So when we test you, we retest, but mostly it's those who test positive that are retested again. Yes, after 3 months. So maybe it was a false positive test.
Okay. So at least it's likely that that could have happened. Okay. So I'm sure we've learned so much today, and want to thank our panelists again. Thank you so much for the education.
You're welcome.
And I just want to add that let's remember to get tested. It's not as scary as we think. Dr. Piaget has told us that. Let's get tested. That's the only way we can know our HIV status, right? If it's positive, then we know the way forward. If it's negative, then we can protect ourselves and prevent ourselves from getting it, right? So thank you all so much for joining us on the consulting room today. And we hope to see you again on the consulting room next week. Thank you so much and have a blessed week.